Cirrhosis of liver. This is basically a histological diagnosis. Fibrous septa, nodule, and architectural disruption. Combination of these three are called cirrhosis. Etiology is cryptogenic, idiopathic, but the commonest is the viral infection, B, C, hepatitis B and C, autoimmune hepatitis. And in this country, peculiarly, Wilson disease is common. 36% of all childhood cirrhosis, and then NFLD is common, NASH or non-alcoholic steatohepatitis, fat obesity related entity. It turns 25% of cases. Turn cirrhosis quite a high figure, 10%, 30%, 40% of the global population obese. They have 25% of them have your this cirrhotic progression, quite common at very large group by far. Drug-induced cases, methotrexate, INS, and few more drugs, anticonvulsants. They can cause liver damage in long term, can have fibrosis with cirrhosis, vitamin E intoxication, storage disease, your Gaucher's disease, hemochromatosis, galactosemia, metabolic disease. They also have their long-term cirrhosis. So these children, how to diagnose cirrhotic? These children are adult. They have growth failure, fatigue, wasted. They have exercise intolerance. They have anemia, clubbing, jaundice, ascites. They might have CNS involvement, hyporeflexia, endocrine abnormalities like gynecomastia and testicular atrophy, delayed puberty. They're sheared. They are they may have features of portal hypertension with variceal bleeding, splenomegaly, and so forth. Discoagulation is common. Hepatopulmonary syndrome is possible, and hepatorenal syndrome, acute severe sort of kidney failure, is common. And your cardiovascular impact is the increased cardiac output and its consequences. The diagnosis is by the liver enzyme ALT, AST, bilirubin, and discoagulation is evident by the PTT, APTT, and gamma GTT. Hypokalemia is common. Viral markers are positive. Wilson disease is diagnosed by the urinary copper and ceruloplasmin, and other etiology, they have their own diagnostic points. And finally, liver biopsy is must to diagnose because it is an histological entity. Treatment is supportive. Your protein, your energy, carbohydrate, vitamin, minerals, and to prevent the encephalopathy, lactulose, your sodium picosulfate, they can be used. Diuretics can in small amount in ascites and hepatopulmonary syndrome, and your renal failure needs dialysis and other supportive cares. Variceal bleeding can be reduced by beta blocker, your sclerotherapy, and your tips in pulmonary in shunt their to in portal hypertension. Finally, the outcome is not that happy when there is ascites. You have 2 years something survival in adult data. When it is refractory ascites, not response with the your on diuretics and other supportive care, albumin infusion, and all this and that, you have only 6 months or so. So the treatment and your prevention of this said etiology are important.